So I get this all the time where I'll get a client that says, I've got chronic pain. And I've read somewhere out there that EMDR helps with chronic pain. And so I'm just curious about it. And I'm wondering if you can meet with me to solve my chronic pain. Okay. Now, so I've met with this woman, and she had chronic pain for 30 years. And so I always kind of just sit there and I listen to their story, because I know when a person comes with chronic pain, a lot of times what's associated with it is heavy trauma. I just got to find it.
Mhm.
When I sit there and I work with them through their trauma with EMDR, guess what goes away?
The pain.
The pain.
Yeah.
Because we know the body keeps the score.
Yeah.
And this woman has a lot of trauma. A lot of things happened to her, and she never recognized it as trauma. She's never recognized that her current life has a lot of trauma in it. And so it's just really interesting that it sounds like I'm treating the chronic pain to them, but I'm really not. Chronic pain is just a symptom of the issue.
Well, exactly. And that goes back, and just kind of throw this in. You and I've had
Yeah.
a lot of conversation about what's going on in this day and time, and what the purpose of us getting together not only gives us an opportunity to just talk to each other, and to have someone to process with, but to talk about the concerns of the need that has always been, but will be up and coming.
Yep.
You mentioned people that who have never had emotional issues, and the physical sensation or feeling or emotions before, not recognizing that I have any of these things, or this people that are saying I've I don't have depression, I don't have anxiety, I don't have stress, I don't have trauma. And you talked about when you start with EMDR, things always show up.
Mm-hmm.
Um,
Case in point.
the physical,
Comes to
yeah.
me for migraines. I just sit there and I'm curious, because I know migraines just don't show up. They don't.
Oh, and you mentioned the physical usually goes unnoticed.
Yeah.
But how are the physical pains showing up? And then we talked about most people being in denial that there is any kind of trauma in their life, which is what
Right.
you just said, and
Which is normal. It's a way we cope with trauma. It's one way to cope with it. It's just the denial of it.
stuff it. Yeah, bury it. So we've known each other for how many years now? How far back do we go?
2016.
That's what I was thinking.
Yeah, 2016.
You started your internship in your master's program the year I opened the new office.
Yeah.
So
Yeah.
I'm a licensed clinical social worker in practice for over 30 years. And I met Taylor because Taylor was determined to do his internship in a private practice setting, which not many people get to do. So, you know, tell
And here's the
a
thing.
little about who you are, Taylor.
Well, I mean, here's the thing with that. The reason, I had already been in a community health situation. I knew what that looked like, but I've never understood how private practices work. How does an individual like Carla survive when I can go just down the street and get mental health services in some building for close to nothing at times. Cost me nothing. Especially even if if you're a student, whatever. Anyways, how does someone like Carla exist, and how does she survive in this world and still do good work? But I would also see Carla like in kind of the fray of the community. Carla would be at these meetings that I would go to, because I'm just, how I work is I like to kind of investigate,
Mhm.
see what's going on within the community, what's going on with my client. I have to know. I'm a researcher first. So it's more so I dive into the private practice because it's not something that I understood. And so I dove into your private practice with you, and man, it felt like the easiest thing someone could ever do, like make a choice to do. Not necessarily easiest, but the safest and comforting, at least under your care. Um,
Thank you for that.
very little stress. I'm going to be honest, you go into a community mental health center, and I would be surprised if you could find me, 2, 3 people that aren't stressed out, staff that's not stressed out inside of an agency.
Which is the reason even before I started my master's degree in clinical social work, I knew I wanted to go into private practice
And I did it. Yeah.
because of the work stressors, in addition to the client, the care you have to be able to give. And I was so reluctant to take in an intern into a private practice setting because it's different than supervising someone in a facility. And you have clients that I just didn't know how they would respond, but amazingly they just responded so well.
Yeah, it felt more like we were a team.
It we worked together. Yes.
And one thing that I loved that I haven't seen yet about your practice that I don't see in many other practices. And I would say that I don't even do it as well as you do yet. And I'm trying to get that in, is case management. You also you're the only clinician that I know that provides, as good as you do, case management for your clients while also providing therapy.
Which goes back to Maslow's
Yeah.
hierarchy of needs.
Yeah.
You have to provide the basic needs. And just as a disclaimer, most insurance companies do not provide for any kind of case management services coming from a practitioner such as myself or you, that is supposed to be providing individual therapy. But how can I provide individual therapy if basic needs, yeah, if basic needs are not being met?
Yeah.
And just knowing how to negotiate the systems. So that's the reason I went to all of the different workshops and seminars, because I was very strong in clinical, but I had to go back and learn good old fashioned social work in terms of case management. So I went to everything that I could go to learn as much as I could about Medicare, Social Security, and resources, and just whatever I could find from people who knew.
Yeah. Yeah.
I followed one social worker around who is now one of our city commissioners. I followed her around. I joked with her about it over the years, about me following her around like a groupie, because she knew Medicare and the Affordable Health Care Act and all of that, just, so well, and was so.
Yeah. I know who you're talking about. And even my wife and I went to her for consultation, on the Affordable Health Care Act.
Okay.
Was it going to be something that would work for us? And so she knew everything. I mean, everything. So, and it's an entanglement, that stuff. And so it's really nice to be able to meet with somebody that can work through it with you, because especially Medicare.
People do not know how to negotiate our healthcare system as it is now. And that is probably part of the reason that people avoid calling up and saying, is there someone in your office, or can we set up an appointment and just talk? And
Well, and if you look at our community agencies, community mental health agencies, they have case managers, but they do not provide the training to those case managers to go out and learn about Medicaid, Medicare. They don't provide that training. They don't. You have to kind of come in, and you're kind of a lone wolf, just trying to make sure that this person's care is the best care that you can provide, and linking them to other resources, usually within the agency. So they actually become very knowledgeable with what the agency has to offer. But outside
so
of the
that
agency,
becomes the realm of case management.
yes.
Okay.
And so, but within that, it would be lovely if somehow they could get training on things like Medicaid and Medicare,
And
Part D plans, Advantage plans, standard Medicare.
and just to help people, well, that people would bring in their stacks of mail and not knowing what to throw away, not knowing what they had to fill out, what phone numbers to call. But so over the years, I have had to do a lot of free work, which is fine. I figure it,
Which you can do in private practice.
Which private practice allows me to do. That is just my way of giving back. And and then what I'm able to do in actual individual or family therapy is considered different, but still a lot of times you're serving the needs of what's happening, what's causing, what the stressors are. So one of the things that we talked about in our conversations as well that we've been having is I have discovered through our conversations that I function in the role of a primary care therapist. So I've taken on the acronym, which I'm not really crazy about acronyms, but I love this, the PCT. And you have gone down the path of specializing. EMDR was how did you get started? How did that passion just go kaboom?
Same thing as a researcher. So I was already working with you as an intern with you. And I had stumbled across this sentence in one of my textbooks that just said, something about EMDR is used to treat trauma. And that sparked interest in me, because I was like, okay, I don't know what EMDR is, but that sparks interest because before that, I was always hearing the way you treat trauma is with oh, they use a fancy term. Let me think of it. I'm having a brain fart. It's like trauma specific care. It's trauma focused.
Trauma. Okay.
We have a trauma focused approach. We have a trauma focused approach at this agency.
And I will throw in another disclaimer while I'm at it that psychobabble is something that drives me insane as well as acronyms a lot of times. But
Yes.
you know, they're pretty good.
You go to www.mentalhealthcommunityservices.com. You open up that page and it says, we have a trauma focused approach. And I've always wondered what the heck that is, right? Like, what approach are you using? Tell me what you're doing. And they can't tell me. Oh, we're just super kind. We don't cause any further trauma. We handle.
Is this serious? What you've been told?
Yeah. Just different things. Yeah. Because there's no answer really. I mean, you can get training in it, and there's this, and you can, really all it is treating a person with dignity and worth and compassion. That's what trauma focused care is. Not making them do anything
and
telling your clients to do something. It's being present with your client
and allowing people to tell their story.
Yeah.
Which is basically how you get a psychosocial history, is to allow people to tell their story.
Do you know what I call that? Social work. I call that social work. Because those are all things that a social worker should be doing in the first place.
Okay.
And so I'm sitting there just wondering about that. And I see this word EMDR, and I'm like, okay, I'm going to look into it. So I look into it, and there's something about eye movements and, something about short term, 8 to 12 sessions, very focused. And I'm like, this is not gonna work. I don't know anybody that can go through 12 sessions and say, woo, I don't have to go to therapy again or see that specialist again. I thought I'm a skeptic. So, but I ended up still doing more research to the point where
until we've been talking, we have not, it really has not been clarified or clear in my own thinking that you work in the role of a specialist.
Yeah.
And I work in the role of the primary care therapist.
At this point, I have no clue what between the difference.
No clue in terms of the difference of
working with what you would call your primary therapist, care therapist, and a specialist. When you
were looking at all this, okay.
I didn't have a clue.
Right. I mean, but now through talking, as we've been talking over these past number of weeks, it's very similar. It's the same type of thing. If you go to your primary care physician to get your regular checkups, and if something's going on, they refer you to a specialist.
Right. And if you come to me as an EMDR therapist, I'm gonna say, do you have a therapist? Do you have a doctor? Did you go to a neurologist? I'm gonna ask that you do a lot of these things before we start.
So back to you.
Anyways.
Back to
so I
EMDR.
I do more research. So I ended up taking a course. I thought,
and I remember when you did that. Yes.
Yeah, I thought, you know what? I've got the money. It's going to be the cheapest time for me to do it as a student because I'm going to get 30% off if I do it this way. I'll get another 10% off if I can get other clinicians. So I got other students to go. And so 4 students got a student discount plus the discount of bringing in another person.
Okay.
So I went. The first day I was there, I was like, I don't know about this. Again, this whole eye movement thing, I don't know what's going to happen. So at the end of the first day, you split up into what we call triads. Okay, so you have one person doing the eye movements and the other person's the participant, and then the other person's the observer. So I, of course, am like, I'm going to be the participant immediately because I want to see how this thing works on me.
Yeah, I would want to go there too. Yeah.
And so that's what I did. And boy, it was nuts. I mean, I felt it almost instantly. Relief. And it just started clicking. It started to make sense. I could honestly tell you, I could see things shifting. My perspective was shifting instantly. Day 2 came. I said, okay.
Do a deeper explanation of that.
Yeah. So when you start processing with an EMDR therapist, okay, especially if we're looking at what we call desensitization, okay, desensitization is taking a memory or an event that you find disturbing. Let's say you find disturbing at a 10, and a 10 is the most disturbance you can possibly imagine. Desensitization is taking that event disturbance and taking it from a 10 and making it down to a 0. Now, a 0 doesn't mean that it's going to go away. A 0 means that when you simply look at it, it no longer disturbs you. So if I'm looking at a picture, any picture in my home, or you just look at a picture and you tell me when you look at that picture, how disturbing is it? 0 to 10. And you're going to tell me a 0. Unless it's crooked, then you may tell me a 1.
Okay.
Okay. And that's what we're doing in desensitization, is we're taking the images and events in your brain, we're recognizing it from a 10 to a 0. And that's what happened to me. Even though I would say I didn't believe, and I don't have as much trauma as much people have in their life.
Go back to when you were a student. So, okay, you've given a general
Yeah, so I'm sitting there as a student, and I've got this event popping up.
You're at this workshop, and you have.
I have an event that pops up in my head.
Okay, event spontaneously popped up in your head, or did y'all?
For the most part. Okay. I mean, there's a script that they followed, and this event popped up in my head. And this event was, I'm sitting at the table with my dad. I'm 5 years of age. Okay. In my mind.